So welcome this morning to looking more closely at evidence for COVID-19 coverage. Earlier this week, you may have seen us talking about how to look at evidence for solutions journalism and how to vet that evidence. Here we're going to have this conversation a little bit more expanded with some great guests. I'm Michelle Faust Raghavan. I'm the West Coast Region Manager for Solutions Journalism Network, and I'm here with our panelists, Cheryl Phillips, Elana Newman, and Matthew Kaufman. And I'll introduce all of the folks. I'll give it another moment for our group to arrive, and if you want to tell us where you're from, we would love to see that. We're also very lucky to have Leah Todd and Linda Shaw here helping to moderate some of the chat and the conversation going on. You might see or hear from them a little bit later today. They'll be making sure that we don't miss any of your questions as those come in. So our guests today, I'm going to start with, in order of the folks who will be speaking. First, we'll start with Matthew Kaufman. He's an investigative reporter and a data journalist in Connecticut who worked most recently for the Hartford Courant. He manages SJN's Positive Deviance Data Project and also teaches data journalism at the Central Connecticut State University. It looks like we've got some comments coming in. Cheryl Phillips teaches journalism at Stanford University. She is founder of Big Local Data. She'll be talking a little bit about that today. Also co-founder of the Stanford Open Policing Project. Cheryl is a distinguished journalist who worked at the Seattle Times and for the USA Today Network. Her reporting has won her the Pulitzer Prize. And it looks like some of our chat people are all saying here where they're from. Everybody, yeah, introduce yourselves on the chat. We'd love to hear from you. Also with us to speak today is Dr. Elana Newman. She's the research director for the Dart Center for Journalism and Trauma. She's also the McFarland Professor of Psychology at the University of Tulsa. Elana works with journalists to help them understand trauma science and best practice for interviewing survivors. So you could ask some of those questions about that. Mostly today, she'll be talking to us about some of the best practices when you're looking at scientific research and how to make sure that you're vetting that correctly. So let me just get started with the way I want to start every conversation these days. We are Solutions Journalism Network, and so we talk to folks about solutions journalism. The reason we have this great panelist here today to talk to you about evidence is a very important part of solutions journalism. Solutions journalism is rigorous, evidence-based reporting about responses to social problems. And we want every story to have response, how folks responded to a social problem with plenty of evidence to make sure it proves its effectiveness, have some insight, and discuss limitations. Those are all things that you can get from either scientific research or some of that data. And we'll start by just mentioning that, you know, when we talk about that, when you're looking at specifically data, we want to work backwards from some of the outcomes using these, what we call positive deviance. And what that means is we're asking the data who's doing a better job, who has improved the most, and what did they, how did they achieve that success? Why aren't other people doing it? So that's a lot of what we're going to be talking about today. I'll get started with Matthew Kaufman. Matthew, can you talk to us a little bit about the work that you've been doing?
Sure. Welcome everyone, especially those of you on the West Coast where it's still relatively early. I really appreciate everyone getting up and joining us from their various quarantined locations. I'm very happy to be here with all of you. You can see there's on the screen here a bit of a database. Let me give you the background of that. My focus is on data, and as Michelle mentioned, with solutions journalism, the focus is on what we call positive deviance and finding places, essentially, who's doing it better, and you know, can other places learn from what they are doing. So there's a ton of data out there around COVID, and we had noticed, maybe a month ago, stories started coming out looking at racial disparities in the data. There were sort of clear disparities there, but not a whole lot of data released about it. So we set about just to assemble and identify those places that were actually making that data available, and figured it makes sense to put it all together in one place so that reporters, if they didn't know it was available for their state or their county or even their city, would have a place to go find it, but also be able to make some comparisons with either neighboring areas or places that were demographically or otherwise similar to their location. So that was the thought behind this project. And when we started, there were, I think, 17 or 18, maybe 20 states that were making this available in just a smattering of counties, and that has improved very considerably. Now 45 states make the data available online. Of 46, the governor speaks about it frequently at press conferences, and we have also about 80 cities and counties in here that have made that data available. And all of this was sort of built on this mantra, at least I have, that if you're going to respond to a problem, you need to understand the problem. We'd be shocked if governments weren't making COVID data available by age, right? If we had no idea, how this was affecting the elderly versus the young, it's important to have that data out there. Certainly geographically, if we had no idea that Westchester and Rockland County are hotspots and what was going on in the Seattle area, it would be bizarre not to have that information. But governments were slow to realize it'd be important to dig into the data and see it broken down by race and ethnicity. So we sort of thought, let's assemble this. It's all in an Excel spreadsheet that's uploaded to a Google Drive that can be viewed in Google Sheets or downloaded. Easy enough bit.ly link. It's bit.ly. And then it's just all caps COVID-race. If you do lower caps, you get a TV station in Detroit with Michigan data, but all caps COVID-race will get you our data. Some places do a way better job than others. There are plenty of caveats with this data that we can talk about, but it's all there. But another sort of mantra, if you're going to work with data, it needs to be good, robust data, and we recognized a number of states did a pretty lousy job actually tracking this data. So we also started on a weekly basis adding for each location the percentage of cases where they didn't have racial identifications for it, and it's pretty dismal. It's gotten a little bit better. There's still, I think, 7 states where a third of the cases have no racial demographic data attached to them. 3 states, a majority of the data doesn't have it. And that can make it much harder to analyze the data unless you were sure, the cases they have are kind of equally represented throughout. But if you're in Michigan and they're missing some, 20% of their cases, and they're all from the Detroit area, well, that's going to change, the real pie chart of where the distribution is. So Michelle, if you go to the next slide, you can see kind of a sense. So this is some of the California counties that are reporting. And again, in this idea of who's doing it better, you can see at the top, LA County, almost half their cases is still unknown for race, and down at the bottom, Santa Clara County, obviously much smaller, with just a tiny fraction. Again, LA, 10 times as many cases, 10 times as many deaths, much larger county. But there might be something that Santa Clara is doing that LA County could learn from. And so a reporter out that way, looking for a positive deviant, might think, let's sort of check in with some county health officials who have, pretty high percentages reporting or low percentages unreported, and places, on the other end of the scale, and see if there's something that might come out of that. So a third slide about hospitalization. I'm probably over my time. We can hold that for questions later, Michelle, if you think that makes sense.
if you could summarize it briefly, that would be great.
Okay, I literally,
Keep going, Matt. This is great.
I set my phone down, I put the timer on my phone and then never actually hit start. So it's like, oh, all right. So a quick point on data. The other experts with us are probably better on this, but I wanted to quickly talk about, there's a ton of data out there, and we see sort of 4 areas kind of constantly reported on testing, infections, hospitalizations, and deaths. And they can all be useful sort of at different, times in the, we lost it, in the sort of arc of the disease. But I wanted to suggest that people keep an eye sort of at this point on hospitalizations. My local paper in Hartford had a story yesterday actually on hospitalizations, but the charts that they showed, that if you quickly saw, I think we've lost the slide, but I'm still seeing the middle slide, but there we go. They had at the top in the paper, charts on deaths and on cases, and it has that sort of, never-ending, nearly exponential growth there, but actually didn't have a chart on hospitalization. So I put together one that's at the bottom of the screen for that, and actually adding in yesterday's data as well. There have been 8 consecutive days of declines in hospitalizations, and I just recommend that as something to keep an eye on and trying to get a sense of the arc of the disease, that obviously testing is inconsistent. Deaths, some people say they're underreported, some people say they're overreported. They're probably underreported, but and there's a delay in those as well. Hospitalizations, I think, maybe I'm grasping for optimism, I think is probably something to keep an eye on. And again, in a positive deviant sense, keep an eye on across locations and see if some trends start developing there, and that might be an indication of the arc of the disease.
And just managing what's happening in the chat, Linda just put a link there that has the blog that you wrote that has that link there, but also the bit.ly that you gave. I'd like to type that into the chat for folks. Could you say
Sure.
that?
So bit.ly, and then it's slash just all caps COVID -RACE.
Okay, I put that into the chat for folks, and also Linda put in, so there was one question specifically about data on people with disabilities, and I have not seen that so far. I wonder if you've been seeing that at all, Matt.
I have not seen that. The National Association of Science Writers has a listserv, and a question had come out a couple of days ago. Is someone saying, hey, what other sort of subgroup should I be looking at? And I know there was a lot about immunosuppressant folks and or pregnant women, a subgroup. I don't remember if there was something there on people with disabilities. I can go back and check that, and I could probably multitask here, see if there was something there, and see if someone may have responded with a link, and if so, I'll report back.
Okay, and just to everyone listening in, and thank you so much for the questions you've already posed in the chat. Feel free to continue to put those in. We'll address questions. We'll have plenty of time for questions after each of our panelists has a chance to just kind of give a quick informational introduction of the data sets that they're working with or the expertise that they're working with. So next is Cheryl Phillips, and Cheryl, I have the great honor of having had her as a mentor of mine with some of the data work that I've done in the past. So Cheryl?
Better unmute. Hi there. Let's see, I think I was going to share my screen and try to do a little bit of a live demo. The good news for me is I'm actually on an Ethernet, so that means I shouldn't lose anything. Otherwise, it's kind of like running with scissors. I just wanted to kind of show some resources that are out there. Let me make sure I'm showing the right screen. I think here we go. Okay. It's not doing it. Sorry, my bad. We'll get there. And so I'm actually going to start with a site that is not my site. I'll talk about mine in just a minute, but this was just launched. And it's a consortium. It's out of the University of Michigan. And they maintain a data archive mostly for, academic social science, things like that. But they have launched a COVID database kind of repository. Let me see if I can get back to it. Here we go. It's the COVID-19 data repository. I talked to the director just last week, and they're really hoping to share it with journalists. So if you kind of take a look, they have this whole resource page on guidelines on publishing data from this repository, and they just have a whole lot of kind of data sets related to the, sorry, I went to the wrong spot, related to the actual repository. And so it's a place where you can kind of just search for, you know, sometimes it's survey data, sometimes it's, here we go, browse COVID-19 deposits. Sometimes it's other types of data, but you know, academic studies, things like that. It's a great way to find experts, and it's also a great way to kind of see what else might be out there. Like here's one on you know, sleep quality and mental disturbances among healthcare workers. You know, so if you're thinking about writing an anecdotal story about, you know, how healthcare workers are managing, you could go right here to this information, talk to those, you know, reach out to those authors. It's just a way to find some of that information. So I think that's a pretty useful data set, and this is a pretty good site. I think it's going to grow, right? They just launched it in the last week. They also have this government's responses to COVID-19. And you can, there are lots, sometimes there are some restrictions on how you can use the data, but it's pretty clearly laid out. So I just wanted to show you that. And then I wanted to talk a little bit about what we're doing with Big Local News, which is an organization I founded here at Stanford. When I left journalism, in terms of, you know, being at a daily news organization, one of the things I wanted to do was create this effort. So I started by trying to get policing data to see if it would work, and we ended up getting 250 million records from 33 states and 57 cities on police stop and search data. And that took a few years, but we, you know, like I could see that it was possible. So now we're trying to do that across domains. And then we just happened to launch our platform the week of the Data Journalism Conference, NICAR, and then we came back and everybody was quarantined. So literally our demo, our beta site became a COVID repository, like almost overnight. And so it's still a beta. I'm showing the screen right now. This is me already logged in. If you go to https://biglocalnews.org, then you will get like a login, and you can log in with a Google account. And when you do that, the first thing you'll see is this here on the left that says create new project, and there, you won't have any projects here. You can see I have a lot of projects, and what I do is I upload data to these projects. So the thing that's most interesting for you right now would be this on the left that says open projects, and you can see a lot of COVID data. So the thing that I think about when I'm seeing a lot of the stories that are being done, you might be doing a story about hospitalization, as Matt talked about. Well, we have data sets that give you information down to the county level about hospital beds, hospital workers, things like that. Some of it came from the USA Today network. Some of it came from the Accountability Project with American University. Some of it we pulled ourselves. It's usually, you know, it's government data that we've kind of cleaned up and massaged and provided like story recipes, guides on how to use the data so that you can be confident that you're using it accurately. So it's not just the data and here you are, figure it out. It's here's the data and here's how you can use it, and here are some caveats. The other thing that we do is we consistently update the daily case reports, and we put them in here. So you can always get the COVID-19 tracker, the New York Times data, the USA Facts data. I think I'm missing one. The Johns Hopkins data, and we're making all of those open projects. I think one of them might not be right now, but they're all becoming open projects. So what happens is we create a project and then we open it up to anybody on the platform, so you can grab this data and download it. And I think that's really important. If you're thinking about looking at those positive outliers, you might want to take a look at, for example, the hospital beds data. once I click in here, you can see I have a lot of files and I have a README. It has data about hospital beds and things like that. And you can take a look at maybe smaller hospitals that are resourced better. And that would be one way you could do that. You could also take a look at, one of the things that I try to do is think about using this vulnerability data set that we have, taking a look at communities and areas that are identified as being vulnerable to emergencies, essentially, in a case of emergency. It's this CDC Social Vulnerability Index. Covers the entire nation. We have a lot of documentation, and we have the files both as CSVs, which are comma separated values, which means you can just open them up in a spreadsheet if you need to. And one of the other things about the data here is, this one might be a little big, but I'll really run with scissors here and try to just open one up. You can actually open these files in something called Dataset, which was, sorry, it's taking me a second here, which was launched by Simon Willison, who is a co-founder of Django, which is this web framework. Oh, it's not working today. That's just because I didn't sign in properly. Sorry, I really am running with scissors. But Simon has basically, we've connected in with this data set. What that does is it allows you to do SQL queries right in the, you don't have to have SQL on your computer. You can do it right from your browser, and you can do it with any of the CSV files. The other thing that Simon's done is all of these open projects, he's actually created a spot in his data set so that you can just go right there and open them up too. And I'll, once I'm done talking, I'll find that link and share it with everybody. The other thing that I just wanted to mention as a resource is we have partnered with Pitch Interactive, and we used the New York Times data. And I mean, this is not, and you've seen this kind of map all the time, right? But the nice thing about this map is, let's say I want to pick a state. Here I am in, what state did I just pick? Wyoming. And you can see now I have this state view. Now I can actually embed this map at that level. So if I'm a local journalist and I want to be able to provide a resource to my readers, I can just give them, I can just copy this code, copy it to my clipboard, put that code in my site. It's just a little short code, and this map will show up, and people can take a look at just the state and what's going on. And you can also just do the state. You can select just the state or just the county, and so you can kind of really just a couple more data sets that we have. One that I just opened up today that I think is really useful, and that is, let's see if I can find it. I thought I opened it up today. I will be right in a minute. Apparently I haven't actually made it open yet, but it's layoff data. So this hasn't been released yet, and so what it is this COVID warn notices. So if you are a company and you are going to furlough people, close your doors, or lay off folks, that you have to give a notice. If you have more than 100 employees, the federal law says you have to give a 60-day notice. Now, there are exceptions to the 60-day part of it because of the emergency, but you still have to give the notice. And in some states, it's employers 50 employees or more. So we went and got all of the data where we could. We are missing a couple of states, a few states. Some states don't put it up in accessible ways. Some people don't really put it up at all, but a lot of states do. And so we have, I think, 37 states, and I'm working on getting New York and Illinois, which are in not great shape because they're like, Illinois is in a horrible PDF. But a lot of these we have scraped or pulled in, extracted the information from PDFs and then made it available. So we have all of these states. We have some README files explaining how to use the data. But if you really want to take a look at what's happening in your area, you can take a look at your state and see where the layoffs are happening and what's been going on with different communities. So that's, I think, also a really useful data set. And I said, it's something we're releasing today. So I wanted to mention that one. And then the other thing that I wanted to mention goes back to what Matt was talking about, and that is that related to demographics, there's a couple of data sets that are kind of in process. Matt Kiefer, who's a JSK Knight Fellow, is building a data set looking at coroner data and trying to get medical coroner data and demographics from that. And so he's trying to build a collaborative effort. So if you think about solutions journalism, one of the solutions is like working together. And so he's trying to pull folks in to upload that data so we can build a repository of data from medical examiners, and especially if we can get demographic data. So I think that's another really useful one. And then I wanted to mention one more thing, but I can't remember what it was for the life of me. So I think I'll stop there.
Thanks so much, Cheryl. Yeah. And so the evidence that we've been looking at so far has been really focused on looking at data sets and making that interpretation yourself, but there's also this scientific research that we're seeing right now, especially when it comes to COVID. And I thought it was really important to bring someone in who could talk about research and who consults with reporters about research, because we're getting a lot of question on how do I know what is something that I can trust. And so Elana Newman is here to talk to us a little bit about like some of the top line things that you really need to remember when you're looking at academic research, especially when it comes to the sciences.
Can you see those slides?
Yes.
Perfect. Okay. So yes, I'm going to move back to a little bit of big picture. You've just heard good use of data, but I'm going to talk a little bit about tips for reading scientific articles in your own reporting. And I think there are a lot of challenges now. Everybody's on deck. All beats are now COVID-19 focused, and everybody has to become familiar with science. And that may not be particularly in your toolbox. Scientists tend to talk in jargon from professional to professional. And your job is to help translate what all this jargon is about. And the other thing I think that's particularly challenging is that these are uncertain times. We know not that much, and the need to talk about what is uncertain is difficult. And clearly, those of you who are tuned in, you want to find solutions. You are solution focused. And your role is to provide accurate, proportional information, and doing that with science can be hard. On the other hand, you have many of the general tools. You have strong investigative tools. You are strong questioners and critical thinkers. You have a healthy amount of skepticism, which is probably one of the most important things when you're reading science. You're creative thinkers. And your synthesizers. We've just seen 2 examples of amazing synthesizing of results. So you have many of the tools in your toolbox. And many of you are used to working with data. You're used to working with numbers. You're used to that kind of thing. But scientists have their own language. And I guess I want to talk a little bit about how to read an article and just give you some general tools. For those of you who are science and health reporters, this is going to be very basic. So this is designed for those of you who are a little less familiar. The first question you want to know when you're looking at one of the articles that are listed maybe in the database that Cheryl just provided is it peer reviewed? Has it yet been evaluated by other people? Or is it in a popular journal? That's important because you'll know if other scientists have vetted it. I personally don't pay attention to the abstract. There's a typo there. I tend to read it last or read it quickly to see, is this an article that's of interest? And then I really focus on what specific questions are being posed in this article. I might read the introduction just to get a sense of where this question fits in. I may come back to it at the end. But the real question I'm asking myself is what specific question or questions are being asked? And why should anyone care about this particular question? And that's the question I'm asking as I am reading. So I usually skim the background to get a sense of where does this fit in? Is this a controversial issue? Does it fit in? Where is it? And then I really hone in on the methods and results. And I ask myself, okay, what did they do? And maybe there's lots of jargon in there that you may or may not understand, but what did they do? Is it answering the question they posed? can I come up with any confounds, any things that doesn't make sense to me? Sometimes I'll even diagram what they did, just to sort of get a real sense of what did they do. And then I hone in if there's evidence on their tables. I really look at their tables. I try to look at their table standing alone before I read the rest of it. And then I really sort of say, okay, what did they do? Then I try to think about, well, who or what animals were studied, if there were animal models, but if we're talking about people. So for COVID-19, a lot of the questions are, were these really sick people? Were these people ahead of time? Were these people working? Who were they? And what are the strengths and weaknesses of that? Then I look at the results. And in the first pass, I don't usually think about what the results mean. I just make sure that I understand what they found before I interpret it. And then I go to, did the results answer the question? And is there another way to interpret them? And then finally, I might go back to the abstract and see if the abstract actually matches what I found. And then I will go to the discussion and what did the authors say? So that's technically sort of a way that I approach looking at this information. I think all too often people just read the abstract and go on, and it's really important to hone in on what did they do, doesn't make sense. And writing down the technical terms, you can figure that out later. You can interview people. You can look at those kinds of things. You've already gotten some resources. These are two that I go to as well that you're probably aware of. I'll just put those up there for a minute. I'm not sure, given the audience and the time, whether I was going to define a couple of scientific terms on statistical significance and those kinds of things. Do I have time to do that, or should we go straight to questions?
Go ahead and take one more minute to summarize that, yeah.
All right, so there are a few technical terms that I think might be important for you to be familiar with. There's sample size, which I've already talked about, and I won't get into it. Sometimes you can answer questions with a small sample, but you're looking at the power, and that's the smallest sample size that's suitable to detect the effect given what you're looking for. But I think the most important thing that I want to focus on is statistical significance. Sometimes people new to science think about that as whether it's meaningful or significant, but what statistical significance means is that it's not due to chance. It's the probability of observing the difference and if the difference exists. So usually the way scientists look is they try to nullify what they want to know. So a value of 0.01 would mean that there's a 99% chance of it being true. It doesn't tell you how big a difference, and that's a really important point that I want to drive home. It just tells you whether that was not due to chance. You need to look at something called the effect sizes, usually in scientific studies, to look at how big an effect it is. And maybe I'll stop there in terms of those kinds of things. But if people have particular questions, I'll be happy to answer them.
So thank you very much to our panelists. I'm going to just start asking some questions from me as the moderator, but while I'm doing that, please do write your questions in the chat so everyone can see those and share them with everyone. So for everyone in attendance, please, we want to see as many questions as possible, and we'll get to those as soon as they start populating. And so just to get started, Alana, if you were reporting right now, or you're consulting with a journalist right now who's getting some of these new reports around COVID, what would be the #1 red flags that you would want people to be looking out for in some of this reporting?
I think overgeneralizing, I mean, all the results, science is cumulative. And unfortunately, I wish there was one study that answered all the questions, but there isn't. And I think really being clear about what is this incremental knowledge and communicating that again.
Thank you. So I want to ask, it looks like there's a question specifically for you again, Alana. Can you repeat the technical terminology definitions? I think they're really important. So repeat the technical terminology definitions.
Is it possible that I can just share my slides after the fact so that everybody has them?
Yeah.
Why don't we do that, and I'll repeat that way.
I will be sending an email out with everyone to make sure that everything is shared. So
okay, so I'll put the definitions there again if that will be the best solution for that.
Excellent. Okay, and so Matt, I wanted to ask you a question because you're here working with us about positive deviance. How can a reporter, when they're looking for those positive deviance in a data set, how can you tell between like an error or an underreporting issue and a positive deviant in a data set?
Right. So I think it's sort of a multi-step process that you know, look at the data and then go, all right, well, how robust are the data? You know, is there something missing here? And if there's something missing, there's not a lot you can do other than be transparent and acknowledge that, or decide, yeah, you know, there's just not enough evidence here in the way scientific studies, right, have the same sort of sense of, you know, you can have in a very informal way, whether or not, you know, not statistical significance, does it pass sort of your own smell test that, yeah, feels like there's some there, and certainly, you know, run it past experts is appropriate. So it's not quite a, how can you, you know, tell what's real and what isn't. It's sort of more a matter of making sure you understand the various caveats with the data and then making a sort of judgment call. Is there enough there? Are there more questions I need to ask? And do I know the right people to ask? Do I need to wait for there to be a little bit, you know, more data to see if this seems more robust? So as both, you know, Cheryl and Lane have mentioned, having some data knowledge and certainly skepticism about stuff that we journalists tend to have is a really good thing always, but certainly right now. I mean, anytime people are desperate for an answer, that can lead to both bad science and bad uses of science, and just taking a step back and making sure you know what you really have. And I loved Elena's tips on reading studies. I'm going to practice ignoring abstracts for now. And I love the diagramming as well, which again, kind of, if you're a data guy and a journalist, you know, making those connections makes sense. So I don't know if that answered the question, but I think the big thing is know what the caveats are and include them in your judgments.
Thanks so much. So I'm going to go to Cheryl, and there's a question about how people can sign in to be able to use big local data. And I have another question for you once you cover that.
Sure. So you just use a Gmail account. So we'll be transferring to something called PressPass later this spring. But for right now, all you have to do is use a Google account and just sign in with that Gmail, and you'll be in. So that, yeah, it's really easy process.
Yeah, you can sign up for that. I was able to do that. Haven't had a lot of chance yet to look at the data, but it was a very easy process for me. So Cheryl,
can I just add one more thing about that? And that is that
please do.
There's a lot of open projects, right, related to COVID, but you'll notice, like I mentioned, Matt Kiefer, who created an open, you can create your own open projects. You can also create a private project and just share it within your newsroom or with other newsrooms with specific users. So you can, like, if you're reporting and you're collecting data, but you're not ready to share that out yet, you haven't published your story. If you want to share it once you have, you can just create a private project, share it with who you want, and then open it up later. So I just wanted to mention that. And then eventually what we do is we archive the data with the Stanford Digital Repository and make it public, actually public, for anybody as well.
So Cheryl, what are the biggest problems you see and errors you see reporters making with data sets when they're first getting started?
Well, I was thinking about when Matt was talking about the fact that sometimes you might get really excited about a pattern that you see, but you haven't effectively vetted the data, right? And so really looking at the kind of, I think, the shape of the data when you first get it. Are there weird gaps? Are there weird spikes? And then drilling into those to see, well, is that a data problem? Or is that really something that bears reporting out? And I also, I guess, would really hesitate to just, analyze the data and then pop a story out. I would call people who know the data and say, I'm seeing this thing. Is it accurate? Is it true? And I'll give you a quick example from years ago when I was looking at policing data in Washington State. There was a really high percentage of searches of Indian, as in East Indian people in central Washington. But guess what? That's just because the state patrol officers were using a drop down and selecting I when they really meant Native American. or American Indian. And so it was a completely false spike, right? That was not happening. It was a different kind of pattern that was happening. And so it was a data problem. And so when you see something like you think, oh, I want to go explore this, make sure it's not a data problem.
Yeah. How was it collected, and was that collected correctly?
Yeah.
So we have a question from Michelle. It says, what do you think the biggest misconception is about COVID-19 in the general public? What data can help correct big misconceptions or assumptions? I'm going to let everyone on the panel weigh into this. I'm going to start with Matt. I think Matt might be frozen. So Cheryl, would you like to jump in?
I think it's just that the data, there's so much data that's not there, right? And it's really hard to say, oh, it's going up, or this is happening. It's without having really important caveats. Like we don't know how many people are being tested. Like if you're saying, hey, look, the curve is slowing down. Like, well, we don't really know that. Like it's just we have to every story should have like a bundle of caveats in it, I think, right now, because there is so much missing data. And then the other point to that is sometimes that's where the story is, right? And especially if you're thinking about solutions journalism, there's a lot of stories about where demographic information is missing or data is missing. You could also look for the places that are actually collecting data accurately and well. What are they doing differently? How did they solve that problem that they're actually able to pull in that data? And can that be a model for other places? And could you write about that?
Alana, would you like to jump in on that?
I think Cheryl just pretty much nailed what the biggest issues are, is that we don't know a lot. And I guess the other place is looking to the future for solutions, some more very clear reporting about when vaccines will be available, what is happening, and what the promises are is probably the only piece that I would add to that.
Okay, so we have a question from Claudia. It says, with many preprints being covered and fast-paced science being done, do you find that you have to do more research and get more outside expert comments to counteract the possibility of bad science getting by? I think any and all of you, do you have a thought, Alana?
Well, I'm not a journalist, I'm a journalist ally, so I should be clear about that. So in answering this, I would recommend that happen, because I think it's a good thing that more information is coming out, but it does mean that you as journalists need to be especially critical and do your sourcing well, from my opinion. But I think journalists should answer that question.
I don't know, I think you nailed it myself.
Yeah, I would say just I mean, sort of in the way Elena talked about, when you read a study, sort of focus on what's really in it, not necessarily the glowing thing in the top in the abstract. I feel like anytime you see something described as very exciting, these results are very exciting, be really, really skeptical about that. Researchers are human, and they can get really excited about what they are finding. So I think, it's always a good time to be cautious and to talk with experts. So I don't know if I'd say we need to do more research and get more expert opinions. I'd say pandemic or no, we should always be doing that with data and with studies.
And we're going to go back to an older question that when we got started, an attendee was asking about how early childhood and family support groups are organizing online play dates. So where could you get information about that? And grassroots efforts to pool stimulus money and redistribute to vulnerable populations. Is there any place where you would recommend people get more information on that, source that, and get a sense of how well that might be working?
I don't know about play dates. I can tell you that there are some efforts, kind of local and regional efforts, to collect resource data and put it out there for the public. I actually have a group of students. They have an open project with some guides on how to do this, where it's about a half a dozen. Well, we have now dozens of students actually. Started with the meals, like finding the sites that were providing free meals for folks, and mapping them. And then they created a map, and then they worked with social service agencies to actually take that map and turn it into a flyer so that they can hand out to people. So for people who don't have access to the map online can just grab it as a flyer from different agencies. And they publish that every day. They update it every day. And they're continuing to maintain it. And now they have this whole resource group of dozens of students here who have added to that and all kinds of community resources for folks who might be in need. And so I think there are some grassroots efforts out there, and I think it would actually make a lot of sense for journalists to try to plug into that and get that data, turn it around and put it out to the public.
So we have a question here from
I can answer the first part of that in terms, now I'm going to go into my mental health hack since I'm a clinical psychologist. You might check with your local parenting center and family centers, as well as your school districts to find out about those parenting questions and then creating databases for that.
So Alana, there's a question from Amelia for you. What are there any particular scientific journals that you read and that you trust? And then there's another question that's I would open to the group.
On COVID particularly, so I'm also becoming very familiar with the literature, and I look at something called an impact factor as well, which is looking to see science and looking to see what the best journals are. One of the things, I put up a slide, and I've sent my slides in already, about this COVID-19 place where I think there's some good science reporting done. It really depends. I don't think I can answer that with one recommendation, sorry.
Yeah, I think there's also just so many scientific journals that we just really need to spend time vetting those as we decide we're going to report on a specific journal. And this question I'm going to open to the whole group. Does anyone have any tips about how to get accurate or accurately read data graphics, maps, and charts?
Well, I would point you to the map that I showed in terms of the case mapping, that you can use that and just embed your own local view if you wanted. So I'll make sure I send the link out. But it's you can actually, when you log into Big Local News, it's right there on the login page. So that's one resource.
There was a video, I believe came through Vox, that I saw earlier this week that was talking about how some people might be misreading some of the very classic curve data graphic that's everywhere in media that people may not fully understand that. Anyone like to chime in on better ways to understanding how to read a data graphic that might, look like it's very clear what it is, but that maybe it's hiding some information that we might be missing?
One thing I would say is one thing that the New York Times is doing, and we have it on our map, on our chart underneath our map too, is that 7-day average line is really important to look at, because there's a lot of variation day to day. There's also these Monday bumps because some counties are not reporting cases over the weekends the way they should be. Sometimes they miss a day. I mean, it's really important to be able to look at things that's kind of smoothed out a little bit, so you're not looking at just that daily choppy stuff. So I think looking at things a little bit more with that 7-day average is also a really useful thing. That's just one tip.
Yeah, if you look at some of the state-by-state charts, you can very clearly see that weekend plateau, and then up it jumps after that. So that is not an invented thing. There clearly are places that just aren't working 24/7 like all the journalists on this meeting are. I would say with that, certainly just make sure you know what you are looking at. Are you looking at per capita data as opposed to overall data? Is it a logarithmic scale, versus a straight scale, and how are those decisions made? A lot of the sort of country arc charts are done starting from after the 10th case or after the first case, and deciding that's a better starting point. Just know what you are looking at, and then decide on your own, talk with experts. Does this kind of make sense? But I think again, there's not always one perfect way to do something, but it's important to always know how the thing you're looking at is being done.
So there's a question here that says, should we worry about and investigate conflicts of interests in the data sources? And I would say, first of all, yes, but then how would you look into them? How would you recommend looking into them?
So I mean, I will say, Elana skips the abstract at the top and jumps right in. I find myself looking out of the bottom of the front page or going back to the end, just sort of, morbid this way. I'm dying to see the conflict of interest statement. And, even after I read it, I'm then not sure I believe it. And I start, Googling the thing. I mean, Michelle is right. The answer to that question is yes. In terms of how to do it, start with places have gotten a little bit better on transparency. Transparency doesn't eliminate conflicts, but at least can help you look into it. And other than that, if there is no conflict of interest statement or you're not sure you trust it, honestly, I long before this just sort of got in the habit of typing in the researcher's name and the topic and seeing, oh wow, they're in a press release from RJ Reynolds 20 years ago saying XYZ. What other research have they done? Who's funded that research? What conflicts are showing up other than the conflict that is or isn't disclosed in this one piece of research?
And you can look at nonprofit data to see if they've ever been on the board of something, right? And just do a search. ProPublica has a great repository of nonprofit data, and I would go there and do a search for who's been on the board. That can be really useful. Or yeah, the other thing that I do is I do the same search Matt talked about, and you probably do it this way too, is that sometimes I'll specify, I'll do an advanced search, so file type :PDF, and then the person's name in quotes, because then I'll get back any, like as you said, press releases or any reports, and it just winnows the search and makes it a lot more effective sometimes.
That's really great advice. The next question is from Geraldine, and I'm going to take that for Alana, please. It says, how can the mental health aspect of the outbreak be measured through data, given how quarantine measures and the general uncertainty of events add to mental health problems?
So there are lots of, I think, sources that you can look at. You can look at utilization of resources in your local community mental health centers. You can look at calls on hotlines. You can start quantifying it in those kinds of ways. You can go to major, there's some surveying, it's not so great right now, but a lot of professional organizations, licensure boards are trying to get numbers. But I would think I would start locally with a mental health usage as a beginning. And again, I'll defer to other panelists if they have ideas about other existing data sources.
I would look, I would think maybe about looking at schools data to see if you can get a sense of the percentage of students in school districts who are receiving extra help. Maybe they have 504 plans or IEPs, which is broad, but at least it's a measure. And then that helps you identify communities that might be struggling more than others, right? So what is that particular area that has a very high percentage of students who are needing help? What are they doing to grapple with it? It kind of guides you into the reporting.
So I'm gonna now, did you wanna chime in on that, Matt?
I was just going to say it is an area that there's probably not a lot of good instant data on. And it's one of the frustrating things with data is we often have really good data long after it's useful or interesting. So it may be more an anecdotal sort of thing of reaching out to experts and getting a sense of what are you seeing, where are you seeing it, rather than kind of hard data behind it, as much as we love our data.
So we're coming very close to the end. I'm going to ask Linda Shaw, because you have been more closely able to monitor the chat. Are there any questions that you'd like to highlight that I may have missed?
Sorry, coming out from behind the curtain here. No, I think you've hit most of them.
Okay. So the one question that I'm seeing here comes from one of our colleagues, Sarah Catania, that says, Matt, based on the data you've collected so far, is there a specific example of a story you think could be done right now?
So there are a couple of places that have almost perfect records in at least reporting racial and ethnic data, while a lot of places do a terrible job, and it's possible there are stories there. We were hoping to identify a place where there was not a significant racial disparity. So we looked, again, not at every place, but just places that at least had 90% or better reporting. Let's compare, what they have to the countywide or the statewide racial demographics. And again, the data is not always in great shape. It's often not maintained in the same way the Census Bureau maintains racial and ethnic data. But of those places we could look at, we couldn't find any place that there wasn't, very clearly that disparity. So, we're still hoping something emerges there. I think for now it can simply be valuable, again, not so much to identify this one place that is doing a really good job, but I think for any local reporter, it's an opportunity to look at what's going on in your state, or again, we got about 80 cities and counties as well, and get the lay of the land of that, and then look at neighboring areas and seeing maybe no one's doing a great job either in reporting the data, and maybe there's a significant disparity racially and ethnically everywhere, but some places that might be doing a little bit better than the county next door. And so I'd encourage people to kind of dive in there, see what is there, see if you do see some slight deviance anyway on the positive side that could be worth reaching out to a pair of counties and saying, you seem to be a little bit better on this metric than the county next door. Is there something unusual you're doing? Again, as I wrote in the chat, data is a tip sheet. It's just the start of the reporting, and then you flesh it out with real people. And certainly if you're working with that data, feel free to reach out to me if you have questions about it and need help navigating it.
I'm just going to jump back to a question that we got from Jody about statistics around disability. My memory of that question was that we just really don't have a lot of that data. I'm just going to check on that again.
Yeah, so I looked through that thread in the NASW where someone was looking for other subgroups. No one had mentioned that. No one had raised that as a question, and so no one had responded with, maybe check out this. I think that's an interesting area, again, with something fast moving, with health departments and everyone kind of overwhelmed. My fear is it's the kind of information that would be valuable to be gathering and just simply may not be happening.
I wondered if the VA had any data, and I haven't looked, but that might be a good place to start.
Yeah, asking the VA, is there other places you might suggest a reporter go if they wanted to at least get a sense, if not good data, a sense of what's going on with folks who are disabled?
You could also look at, you can get the listing or data on group homes, probably state by state, because they're all inspected and monitored, not very well in a lot of cases, but that gets you at least one window into it, not the complete window by any stretch. But I do wonder how group homes are managing in the pandemic.
Yeah. So many questions.
I think advocacy groups, advocacy groups might have a better line into whether there is someone or they, attempting to gather that data. So again, kind of going to the experts to see, do you know anyone gathering the data might be fruitful.
And I now have some great ideas for data that we could try to gather for Big Local and try to get it out there. So I'll start kind of exploring some of it.
Excellent. Thank you all. We want to just remind you, and this is something that we've talked about before, if you missed our webinar from earlier this week, that'll be on the web early next week that you'll be able to watch it. And we talk about that. What is the data you are able to get? And then where can you get other information to chime in to kind of think about what's missing and what's not missing? Those are all things that would be great for your reporting. Thank you all for joining us and being part of this webinar today. I'd like to thank Elana Newman for being here, Cheryl Phillips, Matt Kaufman, Leah Todd, and Linda Shaw for helping manage the chat. Thank you all for being here. We really appreciate it. I'm Michelle Faust Raghavan.
It's 9 o'clock.
This has been a webinar for the Solutions Journalism Network.
Thanks.
Thank you all.
Bye. Thanks, everyone.
Bye.
Bye. Thank you, everybody.